Welcome back, deep divers. Ready to explore another fascinating corner of academia with me?
Always up for an intellectual adventure. What are we diving into today?
Well, today's deep dive takes us into the world of medical education research. But, and here's the twist, we're not just looking at the how of the research, we're tackling the bigger why questions.
Okay, I'm intrigued. It's like we all know medical research is vital. But what actually makes for good research in medical education? What are we even aiming for?
Exactly. Those are some of the big questions this scholarly article toward a collective understanding of medical education research. The Dimer Dialogue Instrument grapples with.
Catchy title.
Yeah.
So walk me through it. What's the article's main argument?
Well, it basically suggests that the field of medical education research is, and I'm paraphrasing here, kind of like a teenager figuring things out.
Uh-huh. Okay, I can see that. It's true. Medical education is becoming more developed, adopting more rigorous research methods. But at the same time, it's grappling with these fundamental questions about its overall role and impact. Like most teenagers, I
Yes. Exactly. It's like they're trying to build a car while they're driving it, which, come to think of it, is a terrible idea.
and probably a very bumpy ride.
Hmm.
But speaking of evolution, the article mentions this shift beyond just collecting data. It's embracing new theories from other fields like psychology, sociology, education, you name it.
It's like they're realizing that to understand how doctors learn, you can't just focus on the medical stuff, right? You've got to factor in human behavior, social dynamics, the whole shebang.
Absolutely. I mean, a doctor's ability to genuinely connect with a patient, to understand their anxieties, that's not just about memorizing symptoms from a textbook.
Right.
It's about empathy, communication, cultural sensitivity. All of these things that are shaped by how they learn and are trained, right?
Which brings us to another key takeaway from the article, the importance of collaboration. And not just medical educators chatting amongst themselves. We're talking interdisciplinary teamwork here.
Yeah. We're talking medical educators teaming up with anthropologists, psychologists, even data scientists, you name it. And it's not just about sharing fancy research findings. It emphasizes making a real-world impact, especially regarding patient care.
Because, let's be honest, at the end of the day, that's the whole point, right? Better healthcare for patients.
Exactly.
Imagine being a patient and your doctor's like, hold on, before I treat you, let me consult my latest sociological analysis of bedside manner. You'd be like, just tell me if I need antibiotics or not.
Huh. Exactly. It's about connecting the research to tangible improvements in healthcare.
Yeah.
But it also brings up a good question. How do you actually measure those improvements? And whose perspective matters most? The doctors, the patients, or maybe even both?
Good questions. Now, there's another big factor we have to bring in, technology. And I'm not just talking about those fancy diagnostic gadgets.
Oh, absolutely not.
Mm.
Technology is fundamentally changing the face of medical education.
Yeah.
Just think about it. Virtual reality simulations let students practice complex surgeries without, actually picking up a scalpel.
It's like something out of Star Trek.
Right. Or how about online platforms connecting medical students across the globe for real-time case discussions? Technology is opening up so many possibilities.
It really is incredible. And here's where it gets really interesting. The article even suggests that the very idea of a curriculum is evolving.
It's true. It's not just a static list of textbooks and lectures anymore. It's becoming more of this dynamic, immersive experience.
So true. It includes everything from hands-on simulations to team-based projects, even real-time patient interactions through telemedicine.
It's like the line between the classroom and the real world is becoming increasingly blurred.
Which is pretty mind-blowing when you think about it. Remember when curriculum just meant dusty textbooks and endless PowerPoint presentations?
Right. It's a whole new ballgame now. And that's both exciting and a little daunting because, as you can imagine, this rapid innovation brings a whole new set of challenges, which, as you might have guessed, is what this article tackles next.
It's like we're in this weird transitional phase where medical education is adopting all these amazing new tools and theories, but still trying to make sense of it all, you know?
Exactly. That's where those growing pains we talked about really come into play. Because the article makes this point that even with all this progress, it's surprisingly difficult to get a clear picture of medical education research as a whole.
It's like everyone's working on a different piece of the puzzle, but no one has the box to see how it all fits together.
Perfect analogy.
Yeah.
The article points to a few reasons for this. One major obstacle is this ongoing debate between qualitative and quantitative research. Numbers versus narrative.
The classic research rumble.
Right. Can't we all just get along?
Exactly.
Well, it's not always that simple. Think about it this way. Let's say you want to study how effective a new empathy training program for medical students is.
Okay.
A quantitative researcher, they might focus on measuring how well students score on those standardized empathy tests after the program.
Okay, so hard data, charts, graphs.
Right. But a qualitative researcher might be more interested in analyzing student reflections, interviews, maybe even patient feedback, to understand how the program impacted things like their communication skills or emotional awareness.
Which both seem valuable, but they kind of paint different pictures of what's happening.
Precisely. And the issue is, these two approaches can end up feeling like totally separate camps, each with their own, language and priorities, which can make seeing the bigger picture a real challenge.
Yeah, I see what you mean. So it's like trying to listen to a symphony, but only hearing the string instruments or the percussion. You're missing out on the richness and the complexity of the full musical piece.
100%. And this tension isn't just about research methods either. The article highlights this kind of tug of war between researchers who are focused on developing these big overarching theories of medical education.
So like a unified theory of how doctors are made.
Yeah, something like that. And then you have researchers who are more focused on, boots on the ground practical problems that they see in hospitals and clinics every day.
Okay, so the big picture folks versus the in the trenches folks.
Exactly. And again, both are incredibly important. But this divide can make it hard to see how all these different research efforts connect and build towards a shared understanding.
It's almost like, are we trying to meticulously map every single neuron in the brain? Or are we trying to understand how all those neurons work together to create consciousness?
And to add yet another layer to this, the article argues that in this pursuit of, scientific rigor, those gold standard research designs, we sometimes lose sight of a crucial element, the human side of this whole endeavor.
You're talking about the actual lived experiences of med students, like the emotional roller coaster of it all, the challenges, the triumphs.
Exactly, that human element.
Yeah.
We can get so caught up in proving what works, in measuring outcomes, that we forget to ask why it works or how it affects the individuals involved.
It's like, what's it actually like to be a med student right now? What are they feeling? How are all these teaching methods and technology we talked about changing their understanding of what it means to be a doctor?
And what about the patient's perspective in all of this? I mean, they are ultimately the ones who benefit from this research. How do we make sure that medical education is not just churning out competent doctors, but compassionate and empathetic healers as well?
Right. It's like remembering that behind all the data, behind all these research papers, are real people, future doctors, patients, current doctors, whose lives are being directly shaped by the decisions we make in medical education.
Yeah, it's a point driven home by this quote from the article that really resonated with me. It says, constant fixation on causation research only serves to narrow the scope of understanding.
Okay, listeners, sit with that one for a second. Constant fixation on causation research only serves to narrow the scope of understanding. What comes up for you when you hear that? What does it make you think about when it comes to medical training?
Because let's face it, medicine, it's so much more than just, diagnosing illnesses and prescribing treatments. It's about connecting with your patients, understanding their fears and anxieties, and guiding them through what might be the most challenging moments of their lives.
And that's what I appreciate about this article, It doesn't shy away from these big, messy questions. In fact, it proposes a really interesting solution, something they call a dialogue instrument.
Yeah, it's definitely not your typical research tool, that's for sure. Think of it less like a microscope and more like, a roundtable discussion maybe.
I like that. So instead of researchers being siloed in their labs, the idea is to bring everyone to the table.
Exactly. It's about moving past this, my research method is better than yours kind of thinking, and really creating spaces for authentic dialogue and collaboration. So picture this. Medical educators, students, doctors, even patients, all coming together to share their experiences and perspectives and insights.
Because at the heart of it, everyone wants the same thing, right? We all want great doctors and a better healthcare system overall.
Precisely. And this dialogue instrument is all about breaking down those silos we talked about, those gaps between qualitative and quantitative research, between theory and practice, between those ivory towers and what's actually happening in hospitals.
Like the old saying goes, it takes a village, or in this case, it takes a whole medical community to really understand how to best educate a doctor who is in tune with their patient's needs.
I love that. And another key aspect of this dialogue instrument is how it emphasizes the importance of actually bringing those stakeholders, students, patients, into the research process itself, not just, as an afterthought.
So not just asking them to fill out a survey after the study is done, but actually involving them in shaping the questions, the methods, maybe even helping interpret the findings.
Exactly. Imagine a research project where, let's say, medical students are actually involved in designing a new curriculum, or where patients are invited to share their experiences to help shape how we train doctors.
That would be incredible. Talk about bridging the gap between research and reality. It's really about recognizing that everyone involved, doctors, students, patients, they all have valuable insights that can contribute.
Absolutely. And one last thing I want to touch on is that this article really pushes back against this tendency to view different elements of medical education as separate silos, like curriculum over here, assessment over there, student experience off in a corner.
Instead of these isolated islands, we need to see them all as interconnected parts of one big system, right?
Exactly. And the dialogue instrument aims to help us see those connections, those relationships, so that we can develop a more well-rounded and ultimately more effective approach to medical education. Seeing the forest and the trees, as they say.
I love that. So as we wrap up this deep dive, what's the one big takeaway you hope our listeners walk away with today?
Well, I think the most crucial message here is that understanding medical education research, it means looking beyond the individual studies, beyond those data points and research methods, and really engaging in these broader conversations about its purpose, its challenges, and most importantly, its impact on patient care.
Because when it comes down to it, that's what matters, right? We want to make sure future doctors have the knowledge, the skills, and the empathy to provide the best possible care.
Absolutely. And that brings us to a final thought-provoking question raised by this article. How do we measure the ultimate impact of medical education on patient care? Is it just about those clinical outcomes, or are there other, maybe even more subtle factors at play?
Right, like how well a doctor communicates with their patients, their level of empathy, or how in tune they are with the social and emotional aspects that impact a patient's overall well-being.
Exactly. These are really complex questions, and there aren't always easy answers. But this article really reminds us that these are the questions worth asking if we really want to create a healthcare system that prioritizes both patient well-being and the humanity of those in the medical field.
It's about more than just training doctors. It's about fostering compassionate healers.
Couldn't have said it better myself.
Well, on that note, we'll leave you to ponder those big questions. What are your thoughts on measuring the impact of medical education? What resonated with you from today's deep dive? We always appreciate hearing from you. Until next time, keep those brains buzzing, and thanks for joining us on the deep dive.